What's up, guys? Dr. Mohammed Ashori here, board certified family medicine physician at drashori.com, where we talk about healthy aging, especially once you pass your 30s. So let's talk about some of the common things that people deal with when it comes to aging past 30. Metabolic health and weight gain are the big problems. So for example, many years ago, maybe as a kid, you dealt with being overweight or obese. And with some exercise in college or high school, you were able to control it pretty well. But now it becomes harder. For women, it's menopause that keeps them from being able to be successful. For men, it's low testosterone. And for most of us, to be honest, it's a lot of stress. It's not being able to sleep the way we want to, and probably dealing with a lot with our mind. So when the mind is very active, stress levels tend to be higher. In fact, I would say that small amounts of high stress are healthier than low levels of constant stress, because you don't really get a chance to recover. Your hormones don't get a chance to recover. As we pass our 30s, the most important thing that I would want to prevent in my patients is metabolic conditions such as elevated blood sugar, constant elevation of blood sugar that can lead to not only pre-diabetes and eventually diabetes, but it can also increase your risk of developing higher blood pressure, hypertension, or plaque in the arteries, which can be pretty much stroke or cardiovascular disease such as heart disease. Most of us don't have any genetic issues with high cholesterol, which means that high cholesterol is something that develops later on in life. Some studies point to the liver, so that if the liver is not functioning properly, then you have a higher chance of developing elevated cholesterol, which can then, due to inflammation and damage to the endothelial lining of the vessels of the heart, it can deposit plaque there. So what's important? Exercise. Exercise is important, but jumping into it too quickly and doing aggressive aerobic exercise can sometimes backfire. Walking is great. That's a perfect way to start. And resistance training is good because it does many things for your metabolic system. For example, exercising can increase the effectiveness of the muscles to take up and store glucose. The increased muscle mass will make it much more likely that when you're sitting down and not doing anything, that your body is still having a slightly elevated metabolic rate, so you can burn through calories a little bit better. And finally, I think for most of my patients who have a better muscle mass, like lean muscle mass in their body, they're less likely to develop visceral fat, which is kind of the fat that is around the intestines and the organs. And that kind of fat certainly will lead to insulin problems and blood sugar problems. The three things that are very effective in this regard is meal timing and fasting, and specifically cutting out things that are likely going to mess with your metabolism. So sugars are going to mess with your metabolism. Starchy foods, not as much. Fruits, not as much. You got to eat a lot of fruit, a lot of fruit. And by then, you're probably just going to get diarrhea before you create any issues with elevated blood sugars. But instead, I think it's the sugars that find their way in our food through snacks and cookies and cakes, donuts, fatty foods that have a lot of sugar, which kind of will move through the intestine very slowly, but you'll get a lot of constant elevated blood sugars for many, many hours. So cutting out as much as possible those foods that have a lot of sugar, and if cutting out is just not an option, introducing a lot of the healthier food options, healthy fats, healthy protein, and healthy carbs is going to make it much less likely that you're going to experience a lot of blood sugar fluctuations. Not to mention that the blood sugar fluctuations, especially when the sugar goes high, is going to result in the eventual crash of the blood sugar, which is going to make you super hungry. The Glucose Goddess does such a wonderful job of explaining that, and I highly recommend checking out her channel. When I say meal timing, I'm talking about avoiding trying to eat when you're stressed and setting a window of not eating throughout the day, such as maybe don't eat late at night because you may not sleep good, or don't eat right away when you wake up, because sometimes it's good to let the body become adjusted or accustomed to these blood sugar fluctuations. And in the morning, especially if the night before you ate something kind of high carb, high sugar, then in the morning you could wake up super hangry and hungry. But letting your body just gently get accustomed to that, even if it's just one extra minute of holding off before you dive into something. It can be a good way for meal timing to help slow down those blood sugar fluctuations, but also help you with your appetite control. Fasting. I'm okay with fasting, or let's say intermittent fasting for people, for my patients, if they have a good amount of muscle mass on them and they happen to have a lot of body fat. But if somebody has very little muscle mass and a lot of body fat, I don't think fasting is a good thing, because you're actually going to lose that bit of muscle mass that you need as your metabolic engine. Now, if somebody has a lot of muscle mass and a little bit of extra, let's say adipose tissue, for example, especially around the visceral area, so visceral fat, yes, I think intermittent fasting can be good, but we usually try to encourage a good amount of resistance training for these people. So below, tell me, what is it that you've dealt with once you passed your 30s, past your 40s? What were the big complications, big issues that you've noticed, the changes in your body, and what metabolic problems are you worried about the most? Leave it in the comments below, and thanks for listening.